questions that I've been asked when I've been trying to introduce a dental laser to customers. It's the three main questions today that we're going to be putting to Dr. Kaushik Naik and to Jay Reddy, because it's about what's going to happen now in the future with this future technology. And I've been involved in dentistry for over 40 years, and always on the sales side and always out there with new technologies. But what seems to be something that many clinicians need to get across to them is that ultimately this is a technology that's coming, and it's just something that within the UK we're very much behind what the market's doing. So anyway, I don't want to dwell on that too much, because obviously we're going to be asking the questions. So I'm going to put the first question over to Kaushik, and that is, what is a dental hard and soft tissue laser, and what does it do?
Thank you, Chris. It's Kaushik Naik. I just introduced myself quickly. I'm a dentist practicing in Bristol. Smile Orchard Dental Practice, that's my practice. And I, along with some of my other friends, have been involved in dental roots education and business solutions as well. If you have any questions along the way during the course, you should obviously be able to ask me, but later on, any kind of contacts for anything with regards to dental lasers or dental roots or any other education, please contact me at naik@smileorchard.co.uk. That's my email, which I will be always responding to. So an amazing evening into the Friday, just before the weekend. We have picked up a topic which I've started to love so much that I keep not having a single day without speaking about it. So let's see what laser is all about, like what Chris asked me. The word laser, when it's sort of expanded on its own, makes a wonderful definition. Laser is a light amplified by stimulated emission of radiation. So laser is nothing but light. So let's keep it very simple. And light which is first filtered into a specific wavelength, because we all know, or probably would have forgotten, because this is physics from 10th and 12th grade. And I probably had completely forgotten about it till I started to think about lasers again. So they're basically filtered a particular wavelength of the light, which is the light that you always see all around you, and then they amplify it so it's more powerful. And that's all laser is in very simple terms. This research has been going on. I think light is something that's been researched for centuries and centuries. I put a few names up there just for us to sort of ponder about. 1862, it's the electromagnetic theory, which is a very popular theory to explain electric and magnetic field by Maxwell. Later on, there were some postulates from Planck's quantum. These postulates were later on researched by Einstein in the early 19th century, and he did come up with a lot of phenomena in absorption and emission mechanisms. Later on, in 1951, Maser, which is with relation to microwave, was something that was studied and certain principles derived by Purcell and Pound, which then led to this whole evolution of microwave in each and every kitchen. And later on in 1960, probably, when the first laser effects were studied and quite a lot of things were discovered, that was by Mayman. A brief history, I would say, about how laser has come into existence and how laser has then slowly started to integrate itself into every aspect of medicine, be it ophthalmology, be it skincare, and now in dentistry. I don't know why, but it's a bit slow in dentistry. And our whole process is to see how we can try and make it more integrated into our day-to-day dental practice. And the whole webinar today was a discussion between us who are using dental lasers and from people like Chris and Krishna, who've been looking into technology in dental implants and all other fields in dentistry. And we had this kind of a feeling that laser is not so well adapted and used in the dental field, probably because a lot of us do not understand the basics and the basic principle and the basic integration issues when it comes to dental lasers and dental clinical application. So my and Jay's discussion for this whole hour is basically to untangle a few of these minor aspects so we all have a better understanding of what laser is, how it is used in dentistry, and how it can enhance our clinical practice going further. During our discussion, we picked up this word, and I was trying to tell them that laser probably is a revolution in the dental evolution into the 21st century. With those kinds of explanation, what I want to first ponder upon is light itself, because it's something that was rusted in my head a long time ago. Because I thought, knowing that I was going into healthcare, light physics was something I could sleep on, and so I never thought about listening to it when my physics teacher taught me. So I had to go back and learn again. I thought that's probably the case with most of us, and this is more or less the graph that is there somewhere in the back of my mind. Light and visible light. So visible light is what we can actually see through our naked eyes, but then there's a big spectrum of light which we cannot see. And that's exactly what this graph here explains. There is a big section of light beyond the violet range, which is called as the ultraviolet light, and there's a big section of light that is beyond the red range, which is called as the infrared light. And a lot of machines that we use on a day-to-day basis, for instance, the X-ray machine that we use or the gamma ray machines that we use, fall beyond the visible mode and into the ultraviolet section, whereas a lot of things like microwaves and radio waves and TV waves are the ones that fall on the infrared structure. And again, that's not something that is visible, but they are the ones that is used immensely in our day-to-day life. When it comes to dental lasers, the only part that we are probably going to be concentrating on, at least for today, is the visible section and the infrared section. And I'll explain exactly why I'm concentrating on those two, because most of the lasers that we are using in dentistry are related to either a visible light laser or an infrared light laser. Okay, so let's just remember those two. I keep summarizing what I said as we go forward. So we discussed about what is laser. It is basically amplified light of a specific wavelength. And then I discussed how light has so many different wavelengths and hence so many different colors and so many different wavelengths which has no color. Okay. From there, I'm now jumping into this specific slide where I can explain how a laser or an amplified light is actually made for a dental setting. On the right hand side, I think we are all used to that piece. Yeah, it's a small handpiece that we use generally for cutting teeth and all the things that we have been doing. But it has a small extension at the end, and that is what's called as a laser resonator. And the laser resonator is where a laser beam is produced. On the left-hand side is a slide which sort of amplifies that whole space of what a laser resonator looks like or is made of. There are three, four colors in it. The green rod that you can see is what which stimulates a laser beam, or which is where the laser beam comes out of. The blue rod that you can see is called a flashlight, and this one, or the flash lamp, sorry, and this one somehow either sends energy in the form of light or heat or some way to excite that green rod. And when the green rod gets excited, it is going to release photons or photon energy. And this photon energy, then being in a chamber, is moving from one mirror to the other mirror. So the two pink objects on either sides are reflective mirrors. One on the further away side is a fully reflective mirror, and the one that is closer to us is a partially reflective mirror. So between the two mirrors, now there's abundant amount of photons released from the green rod going up and down. And as they keep moving up and down, you will start to condense a beam of photons, which will start to get more or less parallel to each other, and then they start to pass out of that mirror. Okay, so where do they pass out? This is the point where they pass out. Once they are passed out of this resonator, It goes and hits the mirror on the end of that tunnel. Then it's reflected to the next one, and the whole process happens, and this whole beam of laser, which is amplified. Now I'm again going back to the definition. What is it? It is an amplified light of a single wavelength. And now you have that wonderful spot of energy that's coming out of that tip, and we now can use it for anything that we think it's ready to be used. Guys, so I've explained about lasers. I've explained about how light is expanded in a way it is in terms of wavelength. And we have just gone about how a laser is made in a handpiece. I don't know, Senthil, if there is any questions at this stage, that would be lovely so that I can get into it, or we can get into the next stage. There's so many interesting slides as we go forward.
No, at the moment, it's no questions. It's nicely simplified how lasers are produced, so it's quite clear. And you can proceed to the next slide.
Good, man.
Just quickly there, actually, Kushik. From a layman's terms, thinking about what a laser does, I think that's demystified a lot of things for a lot of people, because we always assume that a laser creates like a laser beam of heat that burns away. And actually, I think the way that you put it, it's now sounding, instead of it being something which in theory I've had in my head for a long time, what it actually is, it's actually a very safe thing as long as you can enhance it and then use it.
Mm-hmm. Yeah, it is an accumulation of energy. If I can give you a modified version, it's just like you are at the tip of this piece here, and you have probably £1 million in your pocket. If you just get one person here to give it away to, the whole 1 million is transferred to this one person. But say you have 100 people here standing instead of one person. Now that same 1 million, you got to distribute it to 100 people. So it's up to you on how you use that 1 million in terms of distributing it to the target audience. Am I right? And this is what I'm going to start to explain as I go forward, because the way you distribute it is how you can make it effective. Okay, so you are in full control and you have a big bundle of energy with you, and now you're using it in the way you want to use it.
Okay,
yeah.
Thank you.
Perfect. So let's now go to this amazing slide, just to explain what this means. This slide explains two things. It gives us a good idea of lasers of different wavelengths, which means different types of lasers, which is on the x-axis. So all the things on the x-axis basically differentiates different wavelengths of light and what particular substance produces a laser of that particular. Yeah, simplified. And on the y-axis, you have the amount of absorption a particular tissue has for that specific wavelength. Okay, so for instance, there is an A wave, and that A wave has a particular wavelength, obviously. And we have only considered 4 different tissues up here: water, hydroxyapatite crystals, hemoglobin, and melanin. And the reason for us to do that is most of the tissues we are playing with are consistently made of these 4 particles, right? So if A wave is somewhere here, and that laser, if goes and hits water, the amount of absorption is at 1. If it hits hydroxyapatite crystal, the absorption is much higher, and probably the same for blood as well. But melanin, it might not be so much. Okay, and that is how we are able to differentiate different lasers that is there in the market and see how we can use them for different clinical scenarios. Because what we always know as clinicians is the composition of the structures that we are playing around with. We know the composition of enamel, where water amount is about 12% of the volume, whereas hydroxyapatite volume is about 86%. Dentine is about 25 to 45, bone, which is 40 to 23, and so on and so forth. These are things I think we don't have to worry about. Today's discussion is especially going back to the same particular laser, which is called as an Ariag laser, which is at 2040 nanometer. This laser is of high interest for me and for us for discussion, because we consider this laser as an all tissue laser. Okay, the reason why we consider this as an all tissue laser is this has a very high affinity for water and hydroxyapatite crystal, so we can use it consistently on hard tissues. But since it has a very high affinity for water as well, you can very, very well use the same laser for soft tissue as well. Okay, and that's the reason why this laser, which is a YAG laser, is called an all tissue laser, whereas a visible light laser generally is okay to be used on a soft tissue, and it doesn't have the same amount of intensity, power, and absorptive capacity as a YAG or infrared laser to be acting on a hard tissue. Okay, so let me summarize it back again. I keep forgetting things. I get carried away, so I keep summarizing myself. Okay, sorry about that. But we spoke about what is laser. We spoke about laser as a phenomenon and how it gets generated in a dental equipment. We also spoke about tissues which relates to laser and the absorption of different tissues of specific wavelength of laser. And I think all of us then now agree, okay, with that amount of advantage, we should actually have a laser in our dental practice. And that is what I thought 4 years ago. Okay. And then the next question I had in my mind is, oh my, now there's too many of the market. What is it that I got to look for buying a laser? Okay. I did have to do a lot of research there. And one of the main things and the main criteria I thought is something very important to consider before we try to start looking at buying a laser is the way a laser is produced in a resonator and how it is delivered into the handpiece. And the reason is that is the main issue when it comes to maintenance and credibility of using laser on a day-to-day basis. The three machines that I've put across on the screen here, it just gives three different ways of how laser delivery happens in most of the more important machines in the market today. The first one here on the left-hand side, the laser is actually made in the cart, and then it is transmitted through this black tube, which is hanging on a straight articulating arm, and comes to the handpiece. There are two issues here for me. One, as soon as energy goes into this fiber optic cable and has to go through a length of distance before it comes to the handpiece, quite a bit of energy is lost in that process because any material that is there in the way would absorb that energy. Okay. And the second part I wasn't very convinced about is the ease at which you can maintain it in a day-to-day practice setting. All it takes is one wrong move and you break the cable. And do you have good amount of support and do you have good amount of facility within the supplier group to make sure that can be replaced easily? It doesn't lead to discontinuity in your care. And that is where I started to have questions. And then I started to investigate more about other appliances in the market. Then I came across the second one where they have overcome the problem that I just explained you. And what they have done in a very smart move is they have used an articulating arm instead of a fiber optic cable, which solves the problem of losing energy. So the resonator is in the cart, and then the light energy comes out of it, and you see these points here. That is where the reflective mirrors are at every end of the straight articulating arm, and that reflects the beam all the way up to the handpiece, which is very well done. But because of the length of the articulating arm, again, all it takes is some kind of a disturbance in the whole structure. Say if someone just accidentally tapped into it, or if it does go and bang into the wall, or some kind of an accident can de-articulate the whole balance. And that's all is needed for us now to have a beam that is not properly focused, which means then we need to re-articulate the whole space. And do we have the necessary provision for it? If there is a necessary provision for it, if someone is going to come and sort it out next day morning, probably yes, but I doubt it. And that's why I started to get a bit worried up there. Then,
am I right in saying, Kushik, then that ultimately they've used mirrors to deflect the laser itself, you know, in that articulated arm? Because obviously it's not going to go around corners. Yeah. Okay, and
Yeah,
of
that's
course,
absolutely right.
and so the mirrors are also going to be a weak point ultimately
No,
because they,
mirror is the only way you can reflect it. So I don't
yeah,
see a problem with the mirror because
It's
you
the
can get
length.
good quality mirror
yeah,
which can reflect the whole thing 100%. So in terms of reflection, I have no issues. It does does a very good job. But because it's very long distance and it's made of multiple components, it's just a slight amount of movement anywhere
yeah.
will then change the way the mirrors are angled. Okay, and just a tiny bit of a difference in angulation, then the whole beam reflection pathway changes.
Okay.
And that is going to then bring a lot of problems in the final delivery of that laser beam. And,
Okay.
and actually, the second one and the third one are very similar in the way they deliver. Okay, the third one again does the same thing as the second one does. Here the beam comes out, it gets into the reflective mirror, again back into the mirror, and then comes into the handpiece. But the big advantage of the third one is the resonator is not far away, it's just behind the handpiece. So the level of distance that beam has to travel is very, very short. And all the mirrors are between that fixed uplines. So there is very less chances that that kind of an articulation can go wrong. And the bigger advantage with this particular mechanism is this whole piece can be detached very easily and put in a box and posted off. So all you need is someone to send you another handpiece, and this one goes away, and they can take maybe 5 months to repair it and send it back to you. It doesn't matter to you because next day morning you have something in your practice for you to carry on working. Because for us dentists, the most important part is to make sure that we have continuity of care. All right. And that is an important aspect that we need to always keep in mind whenever we do any kind of an investment, because for me, that's the most important thing, whether I'm buying a digital camera or I'm buying a laser machine, or it could be even a handpiece. If I don't have continuity of care, it's a bit of a problem. So I think, Chris, this more or less explains your first question that you asked me about what is laser, right? I
Yeah,
don't
I
know if
think,
there is any further questions. That would be something I can sort of get back
yeah,
into.
no, I think, you've really put it in a really nice way. And it's quite nice to actually think about this in a scientific way. And also, I think the way that you broke it down, that you've done all that research. And so, through your experience, if somebody's looking to get involved with lasers, I think that will answer a lot of the questions. So, they're already on their way down that journey without having to think about that. So, and they were really, really, really good points. So thank you very much for that. I'll move on to question 2, which is again is for yourself, Kushik, and that is, how does dental lasers help me? When I say me, I don't mean me, but you. So how do dental lasers help you?
Yeah, it's become a part of me now, maybe 3, 4 years down the lane. But that was a question I was asking myself when I first started to get into the whole process of dental lasers. The reason why I thought dental lasers is something that I need to integrate myself on is I was looking at some of my friends who are ophthalmologists, who are into hospital medicine, cardiology, and the amount of integration of lasers, even a tattoo guy along the corner, the amount of laser integration within their practice is amazing. And I was thinking we are missing the chord somewhere. It can't be that those guys have more or less transformed their whole practice with this kind of a technology, and then we are not even knowing what this is all about. That is when me with my friend, very good friend and explorer who does all the explorations with me all the time, went on a bit of a journey. We did do quite a bit of traveling just on this basis. We went to Italy, we did a few trips to Germany, because those are the countries where the integration of dental lasers has been much, much better compared to what we see in the UK. And once I started using it, I wanted to categorize it and then see how I can categorize it into a way that it can simplify the whole usage of dental lasers. And this is the 5 steps I would say would make more sense to what I'm going to start to say as I go forward. First thing is the way I got to put my hands together to the guys who are making these lasers these days, because they have made these machines extremely simple and self-intuitive and easy to use. Okay, you don't have to be a scientist to use these machines anymore. It's as simple as you using your iPhone. It's so self-explanatory. It has given proper settings for every kind of usage or clinical kind of discussion that you need to use it on a day-to-day basis. So it's very unlikely that someone can go wrong. All you need is some level of basic training. As soon as you have that, we all are ready to use. And then we can go on training ourselves into it to then see how you can maximize the potential of that machine to your liking. And hence, I would say it's very, very simple. Most of the machines out there are extremely simple to use. And because it is simple to use, I'll also explain you how it is so safe for you to use, especially on the structures. Because we are so used to using drills and scalpels, and we are all worried every time and stressed every time about the amount of damage we are able to do to the structures around us. While you're using a drill, you have two people stretching the tongue on one side and the cheek on the other side because you don't want to ever touch the tongue or the cheek. You are trying to use a scalpel. Now you're worried about the lingual nerve damage and the tissues around getting damaged, and all these issues can be much better dealt with when you're using laser and you're smartly using laser for your day-to-day dentistry. Biostimulation. This is something, again, which is a bit new into the dental field. It's nothing but increased healing. Every time you use laser, all you're doing is as if you're putting additional batteries into the cells. Okay, that cell repair is increased by multiple folds. This is again something that can be gone into depth, and we can speak about it hours together. And that is why I think we are going to have a few more meetings as we go forward to ponder about each subject. But I'm just touching upon this. So whenever we use laser, there's a high amount of healing that happens within the tissue. It is also very effectively used to completely disinfect and decontaminate areas. This should be the reason why we should take dental razors into dental practices, because I think oral cavity is one of the most common areas for infection, because this is one space where we are leaving everything to the open, and we are giving chance after chance for sites to get infected. And if you have a place and a way to disinfect your sites of application, then what better way? And the first three things is what makes it minimally invasive as well. Because if you remember the slide that I just showed you before, you can literally not only target a particular site, but you can also target a particular structure. You can literally target just the bloods, or you can target just the hard tissue. You can target only the soft tissue, not targeting the hard tissue. So that way, the way you can set up the same tip, you are able to keep your surgery and your treatment protocols extremely minimally invasive. And with those 4 points, I don't have to say how comfortable it is going to be for patients, you, and the assistant. So coming to the first point, which is simple and easy to use, this is what I was explaining you. This is one of the shots I've taken from my laser that I use, which is the light touch laser. It's so nicely explained. So you can either pick up a hard tissue or a soft tissue or a gentle treatment. You can then go on to choose what kind of a hard tissue treatment you are wanting to do, whether it's an enamel that you're trying to cut or a dentine you're trying to cut, or if you're using it on a bone. And then you can also then regulate the power if you want to, but otherwise you just press the button ready and the piece is all ready for you to use the way you want to use it. Okay, and that is why I said it's very simple and easy, and because it selects the tissue, it is very safe to your surrounding structures as well. Then coming to the point of biostimulation and disinfection. Okay, it's a big topic on its own. You can go on for another couple of hours just talking about this, but I thought I'll give you an explanation of one of the patients that I have treated, which makes more sense for you to understand how you use it. This is a case where the husband referred his wife. He's a patient of mine for the last 8, 9 years, and his wife was jumping around a few NHS dental practices. She had a few root treatments done. They were all failing. And I think he eventually thought, okay, maybe rather than me taking her for multiple trips, I'll take her to my dentist. So she came into my practice. Okay. So I saw the situation. There was multiple other issues, but this is an issue of interest for today. This is the upper left 5, upper left 6, and upper left 7. Root treatments done not to the standards that you expect it to be. Consistent amount of infection. There's a lot of bone loss. There's a lot of granulation tissue. And we eventually decided, okay, let's get rid of these teeth and then have some implants placed and restore it back again. Took the teeth out, and that is the site I have inside. Previous to what I used to do with dental lasers, the protocol for me would have been I would scoop out as much as I could possibly scoop out, clean it and disinfect it as much as I can disinfect it. I don't think I would have had a heart to do anything other than that. I would have closed it down and then sent the patient off home for the next 3 to 4 months time. Get the patient back after 4 months, take a scan, see if it needs a sinus lift or any kind of a bone augmentation, place implants, send them home, and then maybe 4 or 5 months later, restore it. So, on the whole, the patient would have had 4 visits, a year probably by the time I would have finished the whole treatment. And I'm pretty sure that the healing process wouldn't have been the nicest for the patient as well. But my protocol has changed massively since the time I've been using the all tissue laser. So with this case, once I've taken the teeth out, the all tissue laser was used to degranulate the whole area and disinfect the whole area. And this is how the socket looks immediately after. This, for me, every time I look at it, my eye just glows. And I feel, I just literally tap my back every time and say, mate, you did the right thing getting into the lasers. There's no other way. I personally feel I could have done that. Okay. And once I have disinfected everything, I was also, because I get so confident about the amount of disinfection I can achieve, that I'm able to place the implant at the same time. Okay, and then I've done my augmentation and all of those, which is not of much discussion for today. And look at this. This is healing at 1 week. Okay, and I get amazed every time I see that. And this is nothing to do with me. I am no great surgeon, boss. I'm very simple, but it's the laser that does it. And why I say the laser does it is because the disinfection part is very clear to see. There's proper pictures, we can see it absolutely fine. But what the laser does, which we cannot see, is the power gets seeped into the surrounding tissues. Most of the power goes onto the top, but it doesn't stop there. There's some amount of power that slowly seeps into the surrounding structure, and that seeped power is like charging a battery of your cell. Okay, that cell gets charged up, and that reparative process of the cell increases by multiple folds, and it minimizes the amount of inflammation. So you have a charged up battery which is replicating multiple times more faster than before, and it is minimizing any kind of inflammation. And that's the reason why you can't see any inflammation up here, neither can you see any swelling, and the patient just feels so comfortable. Most of the times they don't even take painkillers. That is what I mean when I say disinfection and biostimulation. This is another case of obviously disinfection, but it's a very good case of minimal invasion. This is one of my patients. She has a high frenal attachment, which is slowly causing some amount of gum recession. She's getting a bit worried. And I said, I think it's very simple for us to take the frenum out, take a detacher, and then that should make it easy for the whole structure to fall back to a good balance. That's exactly what we did. It took me probably about 20-25 minutes for me to take out the frenum with my all tissue light touch laser. This photo is as soon as I did it. Okay, you can see there is no bleeding. It's completely healed. In a way, the area itself looks nicer. Okay, and then that's how the patient went back home. There is no sutures as well.
Was there any anesthetic given at the time?
With her, I did give her a tiny bit of anesthetic, yes, but it depends. Sometimes you can be a bit heroic and say, I want to try without any anesthetic at all. And for me, you need very less anesthesia. I'll show you a next case where I don't even give an anesthesia, but it's better when you're doing surgeries, try to give a tiny bit, so it's a bit of peace of mind, unless the patient is so phobic about anesthesia. I did give a tiny bit here, okay?
However,
And
Kaushik, we can also do biomodulation and reduce the discomfort from anesthesia, don't we?
you can do that as well. Yeah,
Yeah.
you can use lasers at different mode. As I was saying, when I come to the different things that laser can do, I will give you a bit of an explanation there. But depending upon the power of the laser that you're using, you can use it for biostimulation or you can use it for surgery. And even when you use it for surgery, there's some amount of biostimulation that's happening in the outer structure. Okay,
Yeah.
there's a very good paper that I have marked. I haven't put it up there. They have done a study where they burn the arms of a rat on both sides. Okay, both the arms are burnt, and then they are using laser on one arm, and they're not using laser on the other. Okay, the laser effect on one arm is also helping the healing of the other arm. Okay, compared to a control rat. Okay, and so that is what is called as biostimulation within the body.
So in this, there is are you happy to take a couple of questions at this
Yeah,
stage?
yeah,
Yeah.
yeah, yeah.
We got a question from Darshan. Hi, Darshan. Um, how
Hello,
does the
Darshan.
how does the clinical healing show differences when using a surgical bulb or a scalpel as compared to a laser?
The healing is much, much, much better when you're using a laser, because whenever you're using a scalpel or a burr, at the end of the day, what you're doing is you are creating some kind of a trauma to the tissue that you're using it on, and that trauma would then lead to the same kind of a healing process as like any other injury to your tissues, right? The same phenomenon of inflammation and healing and everything else. But when you use a laser, what it does, it breaks that pattern. It breaks that pattern by first, it is going to inhibit the nerve endings from communicating the pain the same way how a scalpel or a drill does. That way, it minimizes the amount of instant inflammation within the structure. The second thing that it does very well is, as I was explaining you, in a low energy mode to the surrounding structure, it is charging up the batteries of the cells. And as it is charging up the batteries of the cell repair is now becoming far, far, far more superior than a normal healing. Okay, guys, I'm using words which is extremely laymanish. If someone feels, okay, this guy is just talking about cells and batteries, forgive me. But as we go, we can go into details about ROS and how oxygen exchange happens, how different cycles work, and so on and so forth. But on a very simplified term, because what I have realized in a few webinars that I have attended about dental lasers, it the pitch goes so high and the discussion is so high-fi. Poor people like me don't understand nothing, and I'm sitting in a corner and sitting, oh my God, what is this? I don't think this is for me. And that is what I don't want to happen. I don't want people like me to also jump in and be a part of this amazing revolution. Okay, and that's the
So,
reason why I'm saying that. But the healing is amazingly, amazingly faster.
okay, that clearly shows in the picture
Uh,
which you have shown. That's just to follow up with that. There's one more question. Do you have any pictures at the tissue or histological level to show adjacent tissue healing post laser related treatments?
Right now in this presentation, I do not have slides to show you, basically because today's presentation was specifically to give a bit of an awareness of dental lasers and not get into the details of it. But what we have done is there is going to be follow-up webinars as we go forward, and these follow-up webinars will be going into the details of each point that is being raised within this webinar, whether it is biostimulation, whether it's disinfection, whether it's a healing potential, what is the cellular level alterations that is going to happen, and how are different lasers working in different level, what is the absorption capacity of tissues, and there's multiple things which are of very high interest for we dentists to understand and then get into, and that is what we will do as we go forward.
Perfect. That's
Okay.
clear. Hope that answers Darshan.
Is it possible I can ask just a quick question?
Uh-huh.
You described the healing as better. How would you describe better? Are we talking about speed of healing? We're talking about the site itself behaving differently after laser rather than being, cut.
Yeah.
So how would you describe better?
Okay, what happens? I'll just take this example itself to make things clearer for you. Okay.
Yep.
So if I've cut this piece with a scalpel, what happens is there is a trauma and then there is a normal inflammatory reaction. And that normal inflammatory reaction then causes a lot of swelling and pain to the patient. And now the whole cycle has to take a long path to then calm down and then start healing. Okay. Whereas when you're talking about laser, what it does is it breaks the path at every interval. So when I'm trying to do the treatment itself, it is first cutting the messaging to the brain itself in terms of the pain pathway. It breaks the pain pathway. Because it breaks the pain pathway by a big way, the amount of inflammation that you see in the tissues is much lesser compared to when you use traditional ways. And also, what it does is the energy that light produces is seeped into each and every cell around. Okay. Any diseased cell or any damaged cell, when you give it more energy, what it does is its repair becomes faster. Okay. It doesn't make a big difference to a normal cell. All right. Whereas when it is a diseased or a cell which needs repair, you give it some kind of low energy through any kind of a laser. That energy is absorbed by the mitochondria of the cell, and that helps the cell to create a hydrogen pump, which otherwise generally gets blocked. And that is how the reparative capacity of the cell is increased. So the cell gets repaired much faster. So the healing becomes much faster as well. So to answer you in simple ways, there's better pain control for the patient. So the patient feels much nicer. There's very less swelling post-surgery. And the amount of healing of the tissues is much, much faster than how a traditional healing happens. Okay. So now coming to heart issues like teeth as well. So this is a patient on the top. This gentleman actually Googled us on Google, trying to find a dentist who does less invasive treatments, and then found us. He came to us. He did not want any injections. He did not want to have any drills. And that is where we have cleaned those initial incipient caries and filled it off. The one below is again very similar. Is a lady who hates injections. She hates to go to the dentist because her phobia for injections. Again, cleaned everything, filled it up. A very, very happy lady. And trust me, this is a bit of a business, but I think I always like to introduce some business because at the end of the day, we got to make the money back, right? Both of these patients who came just for fillings have now finished their Invisalign treatment with me and getting on into teeth whitening. Okay, they are literally just both of them have generated probably about 18,000 pounds of business for me in the last 4-5 months. Okay. This is so I thought it might be nice for us to listen to a couple of these patients on what they want to say about their experiences as well.
We can't hear you. Kaushik, we can't hear.
Kaushik, I think you need to take the...
So I had a Google search and I found Smartwatch's practice and saw that they had this new laser technology, which seemed to be a better way of fixing the teeth, creating fillings. So I spoke to Dr. Naik, and it was a great experience all the way through. Very pleased with the results. And
Hiya, I've just come to see Kaushik. I was advised to have 2 fillings, which I haven't had fillings for about 20 years. So I was used to the treatment with drills and pulling around and injections and everything. I came here today. I'm not numb. I've just had about a 45-minute appointment. My mouth isn't numb. I can go home and I have a hot drink and a sandwich and everything. The laser treatment is amazing. You cannot, you can hear it. You don't feel anything. It's not painful. Overall, it was a really nice experience compared to what I've had previously with the dentist. And my fillings are white, shiny, and beautiful. And I can go home and I can go shopping and do whatever I like now.
That's quite impressive.
Guys, can you hear me now?
Yes.
Yep.
Perfect. So that's a couple of my nice patients who have given me a bit of a nice thing to cherish about. So I thought I'll just give a list of things where we can use dental lasers on a day-to-day basis. Because a lot of times when I speak to colleagues, they say, is it for me? I don't do dental implants, or someone, I don't do orthodontics, or someone else. So we all have our own things that we are interested in when we are doing dentistry on a day-to-day basis. So this probably gives you a list of things which you can do with lasers in a much, much better way compared to traditional ways of doing things. And the journey for the patients is so much better because of the use of dental lasers. For instance, if I can give you an example of aphthous ulcer, the pain is completely gone. I can treat the aphthous ulcer with my all tissue laser. It takes me like 10-15 minutes, and the patient just feels wowed. It's 15 minutes of my time, but the impression it leaves in the patient is what matters to me the most, because from that day onwards, that patient is not going to go nowhere. Okay, and then that's how I look at it.
So in that, sorry, I just want to expand on, is just better healing, a quicker healing, or it takes the pain away as well?
It takes pain away as well. And there are two things, Senthil. As soon as you're doing the treatment, the pain is completely shunted away. It blocks the pain for the patient. The reason why it blocks the pain for the patient is it blocks the C fibers or the non-myelinated fibers. It's a whole journey of how it does it, but in simple ways, it blocks pain for the patient. If you have sensitive teeth, for instance, if I treat the patient's teeth, neck with dental lasers, I just had one of the interviews with one of my patients. When he came to me with very sensitive teeth, his sensitive pain index was from 1 to 10. He was stating it at 10. By the time I finished treating his sensitive teeth, nothing, just with my all tissue dental lasers. I have not done a filling, I have not done fluoride, I have not done anything. I've just been treating the necks of the teeth with the all tissue dental lasers for about 20 minutes. And then his pain perception was 2. From 10 to 2 in 20 minutes, just by doing a proper application of dental lasers on the neck of his teeth. And that's wonderful pain control. It makes life so nice for a patient. Okay, and then the healing is another story. Okay, so for us as a dentist, that is very important, because we want minimal amount of infection and maximum amount of healing post-op, and that's another concept that is again enhanced by dental lasers.
Okay, good to know.
Okay, so we can also, as we go forward in our next sessions, go into each of these and see how we can use dental lasers to maximize the quality of care that we can provide to our patients. Yeah.
Sorry, Kaushik, just to go a slide back, can you just explain? I'm quite curious to know about this veneer removal or crown removal. What is that all about?
Yeah, that's a very interesting concept, and let me share a nice fact about it. Brazil is a country where probably almost every dental practice has a dental laser, has an all tissue dental laser. Okay, and one of the reasons why is because Brazil is a country where there's a lot of aesthetic dentistry that goes in. Almost every person you see there has dental veneers on them. Okay, and the problem when you have a dental veneer, and I used to have this problem all the time before, they come with veneers. Now either the veneer is a bit stained, or or you need to remove it, you don't know how to remove it, every time you have to cut it, and the amount of destruction you sometimes do cutting a veneer because you exactly don't know where the veneer ends and where the tooth starts. Okay, and that is where a big problem is. And say another scenario I always get worried about is you're placing 6 implants, veneers in a patient, and one veneer, it just was offline, and you want to take it off and then put it back again. Is there a way? There is no way. All right. What laser does, because as I explained to you in the graph, it specifically goes and targets water and moisture, and especially the infrared laser. When you are putting infrared laser on top of a veneer or a full porcelain crown, this doesn't work with metal because you know metal blocks laser. Okay, either a Emax crown or a Emax veneer or any full porcelain veneer, when you put laser on top of it, the laser passes through the veneer and it goes and disrupts the cement inside, because cement has some amount of water content inside it, right? So it goes inside and then literally blasts off the cement. And when that happens, automatically the veneer can literally be picked up. Okay, it's completely detached without any destruction to the veneer. Okay, so, and that is how you use it to remove it.
So you're saying that if the patient had an Emax crown, if they've gone into, for argument's sake, pulpitis, you could remove the crown, do the root canal, and you can refit the same crown if provided the margins are intact. Is that correct?
Yes, that is right. Yeah,
that's really good.
Okay, so there's so many wonderful things that can be done. This is one aspect of it, like what you picked up. And the thing why I put this list is for each dentist, there is a part of somewhere here which is their space. And if they know how to use lasers in that space, that would change the way they do dentistry. And that would change the perception for the patients as well. Okay. For instance, a third molar extraction. Me and Jad visited a practice in Italy a few years ago, and this man practices 3-floor dental practice purely on dental lasers. And there are footballers going from the UK to him just to get their wisdom teeth extracted, because it is so painless and the healing is so fast after he does his extractions. And the whole idea behind that is the way he uses lasers to control pain and to enhance healing.
Okay.
Okay.
Actually, sorry, just last question, sorry. In that note, I'm always worried about using lasers. Like imagine I'm doing it in the tooth. If I move around, I'm worried that I may cut the lips, or I may cut the gums, or I may cut the tongue. Is the laser treatments are selective or it's non-selective?
They're extremely selective, and the non-selectiveness comes in our head because of the amount of years that we are using the drills and the scalpels for, and we perceive, in a way, it is good because we are always very careful and vigilant about what we do. But when we use dental lasers, the good thing is you're chosen. That is why you see the screen that I showed you. You're chosen exactly what you are using it for. And that power is literally used for that. And its cutting power is at only 1 centimeter, okay, from the point of delivery. And anything beyond 1 centimeter, the light starts to spread. Am I right? So the power, which was very strong here, has suddenly become very weak outside. And as soon as the power is weak, the whole functionality of that beam is not good anymore. So it doesn't do any destruction to anything.
Okay, so it's very selective. Okay.
Yeah. Okay.
That's pretty much.
And also coming just to the final bits of things, I also wanted to just explain you quickly on the aspect that I was just explaining you, Sento. It's also about the power. So one is about what type of wavelength that you're using. The second thing is about what kind of structure that you are targeting. And the third thing is what is the level of power that you're using to do what you want to do. At very low power is where you achieve biostimulation with dental lasers. That means a better healing. At medium power and some activating tissues, you can use some of the visible light lasers to disinfect perio pockets and make sure that you can do complete disinfection without using any antibiotic. And with higher powers, you can use the laser for surgeries, for coagulation, decontamination, etc. So the same laser can be used in multiple ways, and that is why the laser that I have, which is the all tissue light touch laser, I am able to use it for multiple purposes at the same space. Okay, Chris, do you think that covers the question that you asked me about how I thought I would use dental lasers in my dental practice?
Yeah, I really do appreciate you letting us know, especially when it comes down to some of the indications that you can use it for. Actually seeing the clinical photos as well really is helpful, I think, for a lot of people to see just what can be achieved. Because there's many dentists out there that are doing different parts of dentistry, but what we're showing here is that it can be used in all those different areas. So I think that's really good. So thank you very much for that. I don't think there is any more questions on that section. Is that correct, Senthil?
No, we covered all the questions, Chris. Yes.
Okay, brilliant. So let's move on to question 3, and this is going to go to Jay. And the big question is like, when do you think about considering actually buying a dental laser? So when did you decide to invest in a dental laser?
Thank you, Chris. I'm happy for this opportunity to put forward my views regarding dental lasers, and in particular, my journey to date in the field of laser dentistry. To introduce myself to everyone, I am Jay. I've been practicing dentistry for the last 20 years. And along with Kaushik, as well as Senthil, we are involved in dental education through our Dental Roots platform. And we are trying to improve awareness and expertise of dentists across the globe in modern dentistry, and particularly in laser dentistry, which is very close to my heart. My contact details are on the slide. If you have any questions or want any guidance, please contact me and I'll get back to you at the earliest. Now, getting back to answering the question, Chris, when did I decide to invest in dental lasers? I thought I will briefly give my journey, which is probably what a lot of dentists go through in terms of their experience introducing technology into their dental practice. My first exposure to dental lasers was in dental school. However, this was very limited to the theory of lasers and was taught more of a futuristic science rather than practical reality. This was way back in the 90s. I next encountered dental lasers while attending a postgraduate program in aesthetic dentistry in 2015. This is about 15 years of dental practice later. And I got to use a diode laser as part of the program. This really caught my imagination, and I could see that there are a lot of challenges that exist in day-to-day routine dentistry that I could resolve by integrating this into my daily practice. I soon acquired a diode laser recommended by the course and started practicing laser dentistry. However, I should say I was disappointed with the outcome, as this type of laser was effective only in soft tissue management. And my practice for routine daily practice was not very useful and in the day-to-day dentistry. Later in 2018, when I was doing my master's in implantology, I attended a lecture by Professor Ayaria. I think Kaushik mentioned about him in his discussion. He gave us a lecture about dental laser and how he uses it in implantology, because that was part of my program. This was an eye-opener and revolutionized my thoughts about what was achievable in terms of patient care using dental lasers. Kaushik and we pursued our interest in laser dentistry, visited his clinic in person. He was very kind. He showed us around a lot of clinical applications that we could use it. I was amazed at how he has integrated lasers into every aspect of patient care to solve routine and complex challenges in dentistry. As Kaushik said again, his patients visited him from all over Europe just to avail laser dentistry, including quite a few celebrities from UK. And he has called his clinic, dental clinic, as laser clinic. Having gone through this, we expanded our research, and after reading a lot, visiting many international conferences, and listening to top guns in laser dentistry, we zeroed in on our purchase of all tissue laser in the late 2018. I should confess at this point in time that this, I would say, is the best purchase I did in terms of any equipment I have bought in my dental practice. I'll show you my surgery in one of the later slides. You can see my surgery is high-tech in terms of having a lot of technology incorporated, but I still feel dental lasers has changed the way I practice dentistry. I use my all-tissue laser routinely to provide positive outcomes to my patients with minimal intervention and discomfort. The machine is quite simple to use, is self-intuitive with a very small footprint in the surgery. My journey into this world of dental lasers was just the beginning, and I have enhanced my skills achieving a fellowship in laser dentistry from Eastman Institute, and I'm now working towards an MSc in laser dentistry in Aachen, Germany. Hopefully, I will learn more and try and overcome all my inhibitions in treating any aspect of dentistry with lasers. Sorry, let me just go to the next slide. Just to note, Chris, I thought this slide was very interesting. Actually, Europe is not the leader in laser dentistry as evident in this map. Compared to other advanced European nations, UK actually lags behind and needs to catch up with implementation of this technology. And personally, I feel I want to contribute to make this happen. And that's one of the reasons why with Kaushik, we have decided to do a series of webinars based on laser dentistry, how we can make more awareness happen among our colleagues and peers. Impact of technology. This is a slide I would like you to all watch. My position on impact of technology in healthcare is that evolution towards modernization is a given. As you can see, the left side is a dental practice about 50 years back, and the right side is my surgery. And there is a mega difference in the way the patient journey happens. Even though most of the treatments that they were doing are the same things we are doing, but the patient journey is far significant for both the patient, the clinician, myself, as well as my staff. Change is inevitable. The only question is, am I an early adopter or late into this game of incorporating technology into the practice? So let me show you the next slide. Dental technology, the advances are there seen in dental materials, equipment, software, and treatment protocols. At this point in time, I would like to concentrate more on the dental equipment, which is the dental laser, and the dental software, which is the software used in actually user friendliness of these laser equipment. Patient expectations. This is something which was a challenge for me. And every day I used to think, how do I make my patients happy or come up to their expectations? Now I'm quite happy to say that rather than keeping to my patient expectations, I'm setting new standards for them. And most of them tell me that they're really happy with what outcomes they've had, having had previously similar treatments with conventional techniques. Most of my patients are surprised at how simple the treatment procedure now feels with the use of dental lasers. Being a general dental practitioner with a special interest in restorative and implant dentistry, having an all-tissue laser in my dental practice at hand is a great boon. I can confidently and predictably treat patients with simple treatment protocols, even when things seem too difficult. An example of this is at this point in time, 90% of my implant dentistry is now immediate placements, as use of lasers make this possible even then when there is a lot of granulation tissue, like some of the cases Kaushik showed. Previously, my approach in this situation used to be to extract the tooth, consider a delayed implant placement, but no longer. Chris, I would like to say that the introduction of new equipment or technology into practices involves need for learning. Thankfully, my experience with lasers has been that it is very basic and routine care is quite simple. A big thanks in this to the equipment design and software, which is in itself self-intuitive and self-explanatory, making use of dental lasers quite simple while using it in patient on routine care. If one wants to understand the science of laser dentistry and learn how dental lasers can be used in depth, managing very complex cases, you will need further training, and this is highly recommended to obtain the skill sets to manage these cases. My understanding, personal understanding, is that key to successful integration of dental lasers into clinical practice involves training, core basic training for competency, as well as to further develop expertise in training through formal education, support, which could be from the manufacturers, suppliers, clinical support groups, key opinion leaders, as well as sometimes social media. Marketing is something which is essential requirement to make the investment done in the equipment to find return of investment, as well as to make the patient journey worthwhile. I personally feel patient journey is the key to improving access to this service of providing laser dentistry, and word of mouth is essential to develop this in the local community. Servicing again is important because these are high-tech equipment. Existence of a contractual or a ad hoc arrangement needs to be present. Sorry, so this is a slide which is my most favorite slide, and essentially decided what type of laser I should be using. Erbium YAG lasers, which is basically erbium, yttrium, aluminum garnet, has a strong affinity to water and hydroxyapatite. And since most dental tissues have these in them, this makes the most appropriate wavelength currently for managing most dental tissues effectively. This provides both biostimulation at low energy, as Kaushik was explaining in terms of how healing happens, while ablation effect at a higher energy makes this an ideal all-tissue laser, which can work both on hard and soft tissues, more effective on hard rather than and a bit less effective on soft tissues in comparison to diode, but it is effective on both type of tissues. This slide shows a comparative benchmark on all types of all tissue lasers, with showing various parameters, and this can be seen published over here. My decision to go for the all tissue laser, and I will explain the one I chose, was based on to a large extent on this benchmark, which explains why the light touch laser which I have gone for is better in terms of efficacy and user friendliness. So that's my laser, all tissue laser. This is one of my most favorite toys I've got in my life. Having considered all the laser, hard tissue, all tissue lasers, I invested in this light touch laser. I cannot imagine practicing dentistry without my light touch. It's a better way of practicing routine dentistry each and every day. Chris, Kaushik has spoken about some of the clinical applications that you can use in. I have mentioned over here in general, in the subsequent webinars that we are going to do, we are going to take hold of each clinical application and probably make a series on it. Some of the clinical applications I use in my light touch routinely in my practice are basically in pediatric dentistry. My child patients love it. They don't get any vibrations. There is not much noise. This I feel is the preferred method for treating kids. Oral pathology, it efficiently reduces the symptoms in different oral pathologies like aphtha. Minimal invasive surgeries like how Kaushik showed in terms of frenectomies, which can be oral surgery basically. Aesthetic dentistry, which is basically gingival recontouring while doing smile designs, which makes a large part in my practice. Oops, sorry, I missed the slide and kept talking. And so the next slide is about implantology. This is a major part of my practice. And I find it that precise and minimal invasive ablation of bone can be done over here. It's a non-traumatic bone preparation for the anchorage. The second stage surgery without damaging implants. It is one of the effective treatment modality I practice in case of early stage peri-implantitis. And since we could do implant decontamination without any damage to the implant surface, granulation tissue management is quite simple, and it is amazing at the way it removes granulation tissue from the socket. Periodontics, you could use it. Endodontics, and restorative dentistry. Every aspect of routine dentistry that I practice, I use it, and I find things that I found as challenging to do before, or difficult, or needed multiple appointments, are now much more simpler with very positive outcomes. I got a case, I just got one case that I thought I will show you all. This was done actually 3 days back. Patient had a large periapical infection in one of the tooth. We took the tooth, the treatment we followed was we took the tooth out. We used my light touch laser to ablate all the granulation tissue. As you can see in my x-ray, it's quite a large defect. But thankfully the buccal bone was still intact. Once the granulation tissue was removed, we augmented it with collagen and bone, and then placed an implant straight away. The whole surgery was done in a very, very keyhole technique, where I haven't raised any flaps. It's only intracellular incision. And we even placed phase 2 part of the surgery, that is the healing abutment, was placed in the same visit. And you can see that the healing, the last picture over here that you see, this is actually, today I saw him after 3 days, and healing has already, primary healing is almost complete. And you can see there is hardly any inflammation present. And I think Darshan was asking the question to Kaushik, would healing be quicker? And what type of healing happens? It basically, what it does is it reduces inflammation, improves blood flow, as well as the primary healing is quicker due to the way lasers affect the mitochondria in the cells in terms of biomodulation. Sorry, oops. Yeah. Overall, I feel having incorporated dental lasers into routine clinical practice, and my patients having become aware of this, this has helped me to position myself as an expert laser dentist in my local community, and has shown improved patient journey, providing predictable positive outcomes. As Kaushik mentioned, a lot of my patients come back to me saying that they're happy with the care we provide and want to continue with us. If anybody wants to know how this would work in terms of economics, I would like to explain my understanding of how return on investment works for my practice when I got my light touch laser. My positioning as an expert laser dentist with special interest in laser dentistry has helped me to increase my fee on all suitable treatments by about 10 to 20%, and patients have accepted it with grace. I'm also able to do more work due to the increased uptake of treatments by patients, due to the confidence build up in their care pathway. A lot of it is to do with minimal invasiveness, patient comfort in the during their patient journey in the treatment. The profit earned from this increase over a private fee earning of about 5 to 10,000 should allow the machine to pay for itself. Personally, I do much more, and this slide is mostly when I initially thought about making a purchase of light touch. It was just to give me the confidence that I would be able to manage it. But having gone through now with 3 years of using light touch laser, that is any all tissue laser, I feel it pays for itself over a period of time. This has been my pathway, my journey through the field of laser dentistry. I am quite happy where I have reached, and I aspire to reach furthermore down the line. I'm doing a lot of education, as I said. I read a lot. I'm into formal education in masters right now. Hopefully, I will see you all joining me in this journey in laser dentistry.
Yeah, one of the things, Chris, what I just wanted to add up on that last point,
Sure.
what Jay made was what we are trying in our practice at least is to minimize the number of appointments. So we are trying to maximize the length of the same appointment and try to finish as much treatment as possible, because with the changing scenario, it's very hard for moving multiple appointments with the infection control norms, with the post-COVID norms, and so on and so forth. One thing we are able to very successfully do is multiple treatment modalities within the same appointment. Say if you have 3 or 4 multiple surgical concepts that needs to be done, you need a filling, you need a small frenectomy, or you need to do the crown lengthening, or you need to dig into the gums. Because it's so less invasive, it's all something that you can pack up within the same appointment. And we know from the beginning that the patient comfort level after the treatment is quite good. And that is one of the things that patients have taken up so well. So they have minimal amount of appointment, maximum amount of things done in the same session. And that helps us to keep things going in current situation in a much better way. Yeah.
Thank you. Yeah, appreciate that.
Thank you.
So I pass it for Chris to sort of see how you guys are there too, because as me and Pratap, both of us were basically trying to say the same thing, which means it's not about trying to buy a machine. There should be a lot of them in the market. Whether when you're trying to buy a scanner, or you're trying to buy a laser, or you're trying to buy some kind of a digital, you are integrating a technology into your day-to-day workforce. When you're talking about digital workflow, you are trying to integrate a technology from a lot of different angles. And what we found was very important is to have a team who supplies you with this technology, the team who manufactures with this technology. Are they with you at all times? Are they there for you in terms of integrating that technology into your practice? Are they giving you support in terms of the product itself, but also in terms of the updating of technology? Because technology doesn't stay the same. Whatever I invested today is not going to be relevant probably in a year's time. And are the suppliers and the manufacturers there to make sure you are well in line with that kind of an improvement? And that is where we find Light Instruments International, whom we have been dealing with for the last 3-4 years, and British Dental Supplies, of course, who does look after every part of our machine, work so well. The amount of key opinion leaders that they have put together, the amount of R&D that Light Instruments are putting across the whole world is what makes us feel safe. And that's why I thought, Chris, it's very, very important for you to explain how you guys work as a team whenever you are integrating any practice into this kind of a technology.
Sure, and thank you very much for that. I mean, ultimately, I think, first of all, thank you guys, because you did show us what, how, and when you got involved in dental lasers. But when you initially told me about what you had done many, many months ago, it was quite exciting to hear how you had done so much behind the scenes research as clinicians. But actually, what you want to do is actually pass on this technology to others. And the problems that you felt during your journey to get to this far, you always had to fight systems to make this work for you. And so I got excited because it was a case where I could work with you and start to build a team where we can actually help from the supply and support side, which clinicians need, but currently with many high-end pieces of equipment, the companies, because I've worked for companies for 40 years, so I can tell you honestly, it's about actually selling you the machine, not so much about actually looking after that machine until you stop using the machine. And so that's what excited me more than anything else. And ultimately, though, I gave you quite a few home truths, I believe, and that was telling you that you have to go and supply not just the machine. The machine is just the machine. It's just basically the item that delivers the treatment for you. But we're all, for instance, I'll refer to, say, a digital workflow, you know, the digital. And ultimately, all my time in, say, implantology, everybody had different digital workflows. Nobody even knows what a full digital workflow is, to be honest with you. And today, it's still a very artisan sport for them to use a true digital workflow. And so pointing out to you about how we needed to go back to square one, and that's what we've been doing over the last 6, 7, 8 months, maybe even more, 10 months now, is actually putting in place where we could supply the machine. We could get you accredited to use the laser machine. We could actually then show you how to use it on patients with the different indications for the machine. We won't just deliver the machine, we will deliver it, install it, and commission it for you. In fact, we will then come back for the next 3 years and service it for you and maintain it and continue that postgraduate education so that you become just as passionate as Jay, Sentil, and Kushik, because they had the passion to drive through that, but there must be many machines out there where people maybe dabbled and bought machinery in the past because it's one of the latest things, and it's probably still sitting in the surgery in a drawer. And I'm sure all the clinicians out there can definitely tell me stories about the 15th different composite material that you never actually got around to using. So this is different, and we needed to supply that. And the great thing is the development of British dental supplies and dental routes being able to deliver it. We're really a education platform that's able to give you the equipment for the indications rather than a company trying to sell you the equipment and then maybe give you a bit of backup and supply afterwards. So that is key for us. Who are we? We're only 2 people currently, but that's myself as a communications manager, Chris Bartlett, and Krishna, who I've worked with before in implantology with 2 other companies. is the customer contact manager. And if you look at even our details, we basically just have one phone number and one email. We don't try to fragment it. You have single place contact. So that's who we are. If we can go to the next page, please. Ultimately, I was trying to explain before is what we're here to do. And so fundamentally first, it's about the training, the support, even before maybe even selling you the machine. And also there, we're here to help you implement that and get it into your surgery and then take you to the next level. Because ultimately it will be that team effort that will make it work. And then, do you know what? We will look after it from that point onwards. We will not then just say thank you very much for the order and then run. We're here to actually make sure that we can look after it and it become a fantastic servant in your surgery to help your practice develop even further. So that's what we do. The second one. So we thought, what could we do next? And hopefully it's really whetted your appetite today. It really did me all those months ago, and we're actually continuing right up till today. So encouraging the guys really to start to do more webinars so we can get out and get this awareness up. And so we're going to be doing Demystify Dental Lasers 2 on the 26th of February. And this time we're going to pick a subject or a dental indication, and then talk about using a laser for that indication. I think we're probably going to start with implantology, but if somebody wanted to suggest something else, please do, because we're going to do this on a monthly basis for as long as you want to hear us telling you what it can and can't be used for. We've also got two courses on dental roots, and those two courses, Module 1 is actually a course that gives you your accreditation to use a dental laser within your practice and be a supervisor within your practice. You may or may not be aware that you need to have this prior to actually using a laser in the UK in your practice. And I would say actually that's going to be open from, if you're just a general dental practitioner, right up to somebody that actually knows that they're going to buy it and they are going to forge forward. And the reason why I'm saying that is because it's coming and it will come to your practice. And even if you are an associate, have your own accreditation as a laser protection supervisor is something that you could add to your CV, because that would be something when eventually, as the years go by, there'll be more and more practices with this technology. And that's on the 5th of March. And then also we have the modules 1 and 2. And that also then goes into, now that you're accredited to use, the course number 2, the module number 2, gives you the core basic training on how to use that on a patient. So instead of being a situation where we can then show you how to use just the machine and you're accredited to use it, we will actually show you then with key clinicians who use this technology every day on how they're using it with their patients. So yeah, that sums it up for us. If we can just go to the final one.